Malawi's population is growing at a rapid pace. In 2008, the population of Malawi was at 13.1 million. And in just 5 years down the line, the population hovers at slightly over 15 million people. Yet, most women and men in Malawi report wanting smaller families of not more than 4 children than the current average of almost 6 children, and over a quarter of women have an unmet need for family planning. Such an alarming trend leaves a lot of unanswered questions regarding the extent of scarce natural resources like land, food and water, and access to social services like education and health by 2040. The impacts of rapid population growth are already showing and slowly escalating into catastrophic levels. For sure, this is a multi-sectoral crisis and can only be addressed through a multi-sectoral response.
We are already facing the problems because our population is increasing at a faster rate. It is at 2.8 population growth rate, and for the total fertility rate, each woman in Malawi is having almost 6 children. And if you continue at this rate, the studies are showing that population of Malawi is projected to be at 38 million by 2040. Now we are about 15 million. So we are already experiencing the pressures of population. If you look at the education sector, there is high enrollment rate, and the resources that we have in the education sector are not enough for the students we are enrolling at primary school or secondary school. And we have seen the pressures in the education sector because we have also complaints of maybe the enrollment of students against the teachers that are available. Talking of the health sector is even worse. We have seen complaints about drug shortages. We don't have enough nurses, enough doctors. Even the health centers are not enough for the population. So the resources that we have as a country and the number of people that we have are not correlating well. So even if we go to the sector of agriculture, food security is a problem. Land, there's land degradation. We've seen people, deforestation is also another problem.
Nearly all Malawians belong to one faith or another. As such, religious leaders have a critical role to play in the response. The religious groupings have a readily available audience whose constituents come to prayers on their own without being mobilized. Further, religious leaders have authority within the community and are regarded as trusted sources by their constituents. It is in this regard, therefore, that USAID-funded the Health Policy Project in collaboration with the 6 major religious mother bodies in Malawi to improve awareness of, access to, and use of family planning. The religious bodies are the Malawi Council of Churches, the Muslim Association of Malawi, the Episcopal Conference of Malawi, Evangelical Association of Malawi, the Seventh-day Adventist Church, and the Kadria Muslim Association of Malawi. The project complements government's efforts to manage population growth in the country. And as one way of delivering on this promise, the religious bodies engage a number of strategies. These include holding population weekends, a massive campaign where followers of different religious faiths are sensitized in one weekend about the importance of family planning as both fundamental to family health and as a key national strategy in managing population growth. Mangochi is a lakeshore district which is predominantly Muslim. Being a tourist destination, it is a beehive of social activities and enjoys an economic boom. Mangochi is experiencing a high rate of population, with most women having 7 children, an ideal area for this kind of an intervention. The Muslim Association of Malawi and the Kadria Muslim Association of Malawi are the umbrella bodies of the Islamic faith in Malawi. The two faith groups are in the forefront, championing the message of family planning to their followers. In this Friday's sermon, a sheikh presents the issue of family planning and the importance of slowing population growth to the worshippers at one mosque in Mangochi.
Mwanga tachinyamata timalangiza zonena kuti azikhala nawonso akulowa mtimabungwe tina ndi tina kuti azikhala nawonso akuphunzira nkhani yazakulera kuti nawonso azikhala akufalitsa tikuyenera kusamala ana athu kapena kunena kuti tikuyenereka kukhala anthu oti tizisamalira ana athu pankhani kapena kuti titenge mbali kumbali yazakulera kuti ana athu akhale atsogolo labwino.
Kufuneka kwakulera ndi kwabwino chifukwa choona kuti iwo kamalira ndi kuti umakhala kuti akasoka nyumba koma mamuna samayendayenda chifukwa somakhala busy osamalana ndi umapanga za iwo akabwera kwa anaja akakhala kuti ambirimbiri sikisi kuzikiti sumapita ukapemphera kwa makhala busy osamalirana aja kuzikiti sumapita ndio ukamalira muja anaja amakhala akulu mwina utaumakalima nteza ndumapeza ndalama ndumapanga chituko pa nyumba kumukakhala ndi ana ambiri sumapanga chituko.
The message is worthwhile, timely and relevant. Indeed, family planning as an intervention to slow down population growth comes along with a plethora of socio-economic benefits. Family planning improves the health of mothers and their newborn babies and reduces maternal and infant deaths. With fewer children to care for, couples are able to feed, clothe, and educate their children within their limited means. Natural resources such as trees for household use, water, and land for housing are more available for the country's use. By and large, family planning creates a happy family, which also creates a happy society. It is not only Muslims who take part in population weekends, but Christians as well. The Seventh-day Adventist Church is another faith body that sensitizes its followers on matters of family planning and slowing down population growth. It has a fully fledged family life department which promotes the cohesiveness of the family circle, both for the common good of the church and to the glory of God. As such, the benefits of family planning and slowing down population growth remain critical messages from its pulpits. Rapid population growth has exerted great pressure on natural resources, leading to farming in marginal areas, soil erosion, cutting down of trees, and reduced congregants. Contributions for church development projects due to huge responsibilities for large families, among others. These faithful agree that it is the prerogative of the husband, wife, and the youth to choose family planning methods in order to equalize the socio-economic imbalances being created by the current population boom.
Sanga utenge udindo wake bwino banja mwake ndati zochitika zizingochitika zosalongosoka mbanja zotsatira zake zimene zikupangitsa kunena kuti chiwerengero chizingokula mangokula mdziko lathu. Masiku amene adapita oganiza kunena kuti amene wakhala ndi ana ambiri ndiye mwamuna ameneyo kusiyana amene ndi amene angakhale ndi ana ochepera. Maganizo amene ndinena kuti adapita. Simasukuso anonena kuti mwina atidziganizira za zinthu ngati zimenezozo. Mwamuna oyenera ndi amene amaganizira za tsogolo la ana ake osati uoneke kuti ndiwe mwamuna chifukwa choti mwina uli ndi ana ambiri. Wina wake oyimba adayimba kunena kuti kubereka mwana mposavuta kumakulera.
Ife ponga mu mpingo wathu timalangiza achinyamata amene akuyembekezera kupeza mabanja awo kuti choyambirira ayina kuganizira kufunsa mulungu kuti no mzawo amene angampeze akakhale munthu amene angathe kumagwirizana zochitika mbanja mwawomo. Choyamba zisikafunsana kuti kodi no ife tatakhala mbanja tikaberekana angati kuti ngathe kuwasamalira. Ndeno usokosi pamene bobo akathe kusamalira kupeza chakudya mosavutikira kuwaveka ana amene ajawo komanso moyo wa uzimu kuti akathe kuphunzitsa ana amene aja kuti akamdziwe mulungu wakumwamba mosavutika. Chifukwa akaberekana ambiri chithandizo chimakhala chochepa ndiponso uzimu umachepa chifukwa aliyense amapanga zofuna zake.
Echoes of songs of praise, smoke of the burning frankincense, and the Eucharist. All these remind one of a beautiful Sunday where church traditions prepare the worshipper for solemnity of veneration. Catholics are equally concerned with issues of family health and slowing down population growth. The issue of family planning and population management presents a commonality shared by both Catholics and Protestants. And just like twins speaking one language but with different dialects, there is but a thin line that demarcates their dimension of position as regards family planning and slowing down population growth. The Catholics recommend the use of natural birth control methods to their faithful. Today, there is more to it. The congregants will be given the chance to contemplate on yet another solemn belief held by the Catholics, namely family planning. The Episcopal Conference of Malawi leaves no stone unturned as the family planning and slowing down population growth agenda takes center stage.
Abanja abamene akuyamba njira ya chilengedwe choyamba ine akuyamba ndi chikondi mmene ndanenera kale poyamba. Kuli njira zingapo zimene zikulimbikisidwa. Kuli njira yoona chikazi imene mayi ayenera kuyamba kudziwa mmene chikazi chake chilili mu nyengo zosiyana-siyana, nyengo zimene iye angathe kutenga pakati kapena iyayi, nyengo zimene ayenera kukhala malo amodzi ndi abambo kapena iyayi.
The Protestant churches also advocate for awareness of, access to, and use of modern contraceptives such as oral pills, injectables, and permanent methods like tubal ligation as family planning methods. This message is being spearheaded in almost all the Protestant churches by the Malawi Council of Churches and the Evangelical Association of Malawi. But how did the faith-based bodies get together? Olive Ntema dismisses rumors that religious leaders do not support family planning interventions, saying religious leaders are in fact critical players in the dissemination of messages of family planning and slowing down population growth. She sheds more light on how her organization works with the religious leaders to champion its objectives.
We also had the same notion that religious leaders do not support issues of family planning or religious leaders do not support management of population growth. But when we worked with them, we understood that no, they are also in support of the efforts to slow down population growth. And how we dealt with them is that we started at national level, consulting each one of them, the key mother bodies of religious organizations in Malawi, working with them. I should mention the religious bodies. We have Malawi Council of Churches, we have Muslim Association of Malawi, Kadria Muslim Association of Malawi, Episcopal Conference of Malawi, and the Evangelical Association of Malawi. So we had the individual consultations to have their buy-in, and when they are ready, we hold a national meeting with the key mother bodies where they discussed these issues. And they also felt that it was really important for them to take the messages to their faithfuls. So from the national level, went down to the regional level to sensitize even the regional level stakeholders. And from the regional stakeholders, that's when they had planned to take the messages to the mosques and also to the churches in the country.
Making a better Malawi for tomorrow remains everybody's responsibility. But this can only be achieved if the problem of Malawi's rapid population growth is squarely addressed today. It is incumbent upon all critical influencers and decision makers, like faith leaders, to take the lead in setting the stage for a better Malawi by continuously sensitizing their followers on the links between family health and the country's social and economic development. Reproductive choice and the use of family planning is both key for improving the health and well-being of families, as well as slowing down population growth. Let us therefore join hands in ensuring that family planning services are available and accessed by every Malawian of reproductive age.